Dr. Stephen Sinatra, board-certified cardiologist, states, if you ask me for the most powerful nutrient for heart health, hands down, it would be CoQ10. And I agree. But CoQ10 is very confusing, especially trying to figure out what form to take. So today, I am breaking it down for you. I am going to tell you what it is, what are the important benefits of CoQ10, and what is the best form that is the most absorbed in your body, and what is my favorite form of CoQ10 right now and brand. And it's coming right up. So hey beautiful people, this is Lindy Ford, registered dietitian, clinical and licensed nutritionist, and nutrition detective. So thank you so much. If you like this video, please give it a thumbs up, and also follow me on, I'm on everything. So just follow me on everything, okay? Because I post constantly and it will encourage and benefit you. And please join our YouTube family here and subscribe to this channel. Hey, what is CoQ10 anyway? I know you've heard of it. I know you've seen the commercials, but what in the heck is it? So it is a naturally occurring nutrient used for energy production within our cells, within the mitochondria of the cells. It's manufactured in the heart, the liver, the pancreas, but unfortunately, as we approach the ripe old age of 30, it starts to decline. It goes up in childhood and it increases until we reach 30. Also, if we are taking pharmaceutical medications, certain ones, and hang with me, I'm going to give you a whole list of the ones. It's not just statins, but also if we smoke, we have less CoQ10. So aging, pharmaceutical medications, smoking, we're kind of doomed. So a lot of us are in the boat of not having enough CoQ10. There are two forms of this important nutrient. One is ubiquinone and the other one is ubiquinol. And up until 2007, we only had ubiquinone, but scientists figured out a way of encapsulating ubiquinol, and now we can get that form as well. Ubiquinone is the oxidized state. Ubiquinol is the reduced state. It's the active form. And what they do, they actually flip back and forth for energy production. They take food and they help you to create energy at a cellular level. The all, though, is, like I said, the active form, but it is also the antioxidant form, which is so important. This is not just any old antioxidant, guys. This is powerful, potent. It's amazing. It is why I believe in intelligent design, because it's so amazing for our body. It can regenerate itself, unlike other antioxidants. It even regenerates other ones like vitamin E and vitamin C, and it protects us. And that is why people call this an anti-aging nutrient. CoQ10 actually helps to reduce free radicals or neutralize free radicals, and those are the substances that damage the DNA of our cell and cause cellular aging and cause us not to be really our best selves. So that is why it's important as well. So one of the facts that we do know is that as we age, you know, they go back and forth. If you don't have enough all, you'll make own. If you, or own will make all will make own, right? But as we age, the ubiquinone doesn't convert to ubiquinol as readily. So that's something to just tuck away in your brain, because we're going to talk about that later. And hang with me, because I am going to tell you the benefits. I'm going to tell you the forms that I think are the best absorbed, and that's going to be at the end. So what are some of the benefits? Well, this is a no-brainer just because of what I just said. It increases energy and vitality. Now, this is not the jittery, nervous energy that you get from caffeine pills or guarana. It's not that kind of that kind of nervous energy. It is cellular energy. This is so important for every physiological function in our body. It just makes us feel better. I know that when I put patients on it, they make comments to me Like, I feel 10 years younger by taking CoQ10. So another benefit is that it improves the symptoms of congestive heart diseases. That's why Dr. Sinatra said those words. It is amazing. And anyone with coronary artery disease should be on CoQ10. There's a great analysis that I studied on 13 different clinical studies that stated that CoQ10 significantly improved how well the heart pumps blood. That's called the ejection fraction. And that's very significant. And one of the longest and largest clinical studies on CoQ10 stated that 300 milligrams for 2 years significantly decreased the chance of an adverse cardiovascular event, meaning any type of like heart attacks and things like that, by 30% compared to placebo. It also tempers cardiac arrhythmias. There is a clinical study that stated that after 6 months, now get this, guys, after 6 months, 87% of the patients with cardiovascular disease actually had symptoms decreased, like their quality of life went up. They had less fatigue, they had less memory issues, they had less shortness of breath, and their activity levels went up. And that's 87% with CoQ10. But it's really interesting that they saw no difference at 3 months. So what do we know about that? So to reduce your symptoms of cardiovascular disease, and I don't know about whether it's going to help with the energy for people who don't have cardiovascular disease, it's going to take more than 3 months, probably more like 6 months before you feel anything or any of your symptoms are decreased. The other thing, this is kind of a mixed study on this, but it helps to lower blood pressure. It's mixed, but I think that I saw enough evidence that I can tell you that that probably is one of those benefits, but you've got to be taking it up to 6 months to see any kind of clinical difference. Number 4 is that it lowers the bad cholesterol, and more importantly, kids, remember, I've said this before, it lowers triglycerides, which I think is more important for reducing your risk for heart disease. Now, studies show that it decreases LDL. Now remember, cholesterol is not your enemy. We need cholesterol. We just don't need it. We don't need that bad cholesterol, or part of that LDL actually is good. There's part of it that's bad, the small particle size. We don't need that in abundance. But it did actually lower it by 6.5%. But this is more significant. It lowered triglycerides by 20%, which I think is amazing. And then number 5, it helps to reduce the frequency of migraines. I have a lot of patients coming in with migraine, a lot of migraine sufferers. And one study that I looked at actually said that 300 to 400 milligrams per day increased the reduction in the frequency per month of migraines. And I know my migraine sufferers are singing hallelujah to that one. Then another benefit is that it could aid in fertility. Some of you like that, some of you may not like that, but remember what it does. It neutralizes free radicals. And as we get older, our eggs are not as protected from those free radicals. So it may have a protective quality over the egg, but it also helps on both fronts. It helps the female and the male in that it increases sperm motility, makes the little guys able to, do what they're supposed to do a little bit faster. So that's also a increase in fertility. Then also what it does, it helps with the side effects caused by statins and other medications. Now the side effects, I hear them on a weekly basis, guys. I hear them all the time because I've got people complaining about these side effects. And that is muscle pain, brain fog, neuropathy, memory loss, shortness of breath. And let me say this, guys. Y'all know by now that I'm not a big fan of statins. I'm not saying not to take your statins. You have to make that decision on your own. But the statins actually, and other medication, I'm going to go hang with me because I'm going to tell you what other medications mess with your CoQ10. But for loss of a better word or a better way of saying it, they gunk up the pathway that CoQ10 needs. You just need to know the risks of statins. If you go on a statin, you must know what you're putting in your body. You must understand that. If your doctor's not telling you, you need to do your research, and well, you're doing it right now by watching this, which is great because there is a brand spanking new study in the British Journal of Clinical Pharmacology. Researchers found a 38% increased risk of diabetes 2. Okay, so that is important to know, that your risk for, you're trying to get your cholesterol so low, and yet your risk of diabetes is going up. And here's what I don't understand. You need to realize that CoQ10 is heart protective. If you take pharmacological drugs that reduce your CoQ10, you're actually putting yourself at a greater risk of heart disease. You must do something about that. Plus, on top of that, if you take a statin, you're reducing it, and you're also increasing your risk for diabetes. And to me, that's just a perfect storm of problems. So you do what you feel is right, but do your research. No. If you want more information about this, I think the person who writes the best about it is actually a psychiatrist by the name of Dr. Kelly Brogan. She's an MD psychiatrist. Look at her blogs, find out more there, especially with statins in women, and how she views that, because I think she'll give you a different perspective on statins. If it were me, and I'm probably heart disease, diabetes ready to happen. You know, my parents died at 51 and 52. My dad died at 51 of heart disease, and both of my parents were very unhealthy. So my genetics are not very stellar. But if I was at a risk for heart disease, which I'm not right now because of lifestyle choices, CoQ10 and things like that, I would do everything possible to lower my cholesterol in a natural way, and that being a high nutrient dense low carb diet. I'll link that link below on how to kind of start a low carb plan. But other things, supplements like omega-3s and berberine and CoQ10, like I'm talking about right now. And I'll link some links below on omega-3s and berberine and things like that. That's me. I'm not saying for you. I'm saying that you need to make your own decision, but you need to make an informed decision. So these are some of the drugs that, not all of them, but I guess the worst offenders, statins being number one. But these are the other drugs that wipe out your CoQ10. So if you're taking any of these drugs, you're going to need to up your CoQ10 game. Like antihypertensives, like beta blockers, like atenolol, metoprolol, propranolol, those types of drugs. And also glucose lowering agents like glipizide and glypiride. And those are the types of drugs that deplete and really deplete CoQ10, and that's going to raise your risk for heart disease. So another benefit of CoQ10, and I kind of lumped all these together, but this is a big category. It actually reduces the symptoms related to mitochondrial diseases and preeclampsia, muscular dystrophy, and Parkinson's disease and depression. So all of those symptoms will go down with CoQ10 of those particular diseases. So here's the hard part. We all know now that CoQ10 is important, and you may have known that even before you watched this video, right? But what form is the best? And I have to say, for years, I was a little confused about this, because honestly and truly, practitioners are not in agreement on this. And I will give you my opinion, but I will tell you that there's not a lot of good research there to support anyone's opinion on what form is best. Now, like Dr. Steven Sinatra, he actually says that the ubiquinone is just as good as ubiquinol because it gets converted into ubiquinol. But then I always also look at other research that says that it doesn't get converted as you age as well, and that all form is the more potent antioxidant form. There is one study that has really solidified it more in my mind. Again, I'm not 100% on this. If you have some interesting things to share or studies to share, I would love to hear them or see them below. But there is a study that shows that ubiquinol, actually with patients that are shown deficient, it actually gets their bodies to a non-deficient state faster and better than ubiquinone. And what does that tell us? You know, I'm all about absorption, guys. I will say it and I will say it again. You are not what you take in. You are what you absorb. Well, ask my vitamin D deficient people that one. It's not what you take in. It's what your body can absorb the best. And I believe because of that research that ubiquinol is your best bet for CoQ10. All right, so like I said, in 2007, scientists made ubiquinol, but guys, it is not a cheap supplement. This is probably gonna be your most expensive supplement. I think it's worth it. I honestly think, especially for you guys over 40, any of you all that are on any of the medications that I mentioned, or if you have heart disease, I think you should just not eat out as much and buy your CoQ10 and the ubiquinol form, because I think it's that important. I'm actually upping my dosages of it. Now, you might say, okay, I understand. I want to get CoQ10. I just don't know what form to get. Well, let me tell you, the best form of CoQ10 is called Konica. And a lot of times you'll see it'll say QH. All that means is CoQ10 that comes from the people who developed the all form of CoQ10. There are other forms, and you know what? A lot of times what it is, it's a form of CoQ10 that is paired with some nutrient that helps with the absorption, right? And normally it's some type of oil that is going to help with the absorption, because oil is what CoQ10 needs in order to be absorbed. So whenever you take CoQ10, you always want to take it with a meal that has a healthy fat. There's another good reason to do your healthy fats. There are other ones there's something called QBEST, and that is CoQ10 with CLA, conjugated linoleic acid, which shows better absorption. And there's also one called Q-Gel, and that's a little bit confusing because that's a solubilized CoQ10 with polysorbate 80, and all it is, it just makes it water soluble. So it shows that it's absorbed without having to have an oil base. But I'm not really sure that that's important, because you could just put the oil in the supplement and have a better absorption. There's also good absorption with vitamin E. We have studies that show that. There's also studies that show that L-carnitine is a good carrier and helps with the absorption of CoQ10, as well as something called piperine, which is black pepper extract. OL is the most important part of this, okay? So you need some type of oil, or if you're gonna do water soluble, the polysorbate 80, for it to be better absorbed. Okay, what dosage? I have to make this disclaimer. If you're going to take CoQ10, you know what I'm gonna say. You must talk to a healthcare professional before you take that supplement. The reason I say that is because if you come in to see me, I know what drugs you're on, I know your medical history, I know what you're eating, I know all of these things about you, and I don't know that on YouTube, okay? So I cannot make a blanket statement, you need to take this amount of CoQ10, because if you're taking a blood thinner, it could actually interfere with that. So you need to be careful and you need to talk to somebody first. But here's what I want to say. These are just rules of thumb. If you ask me about specific dosages down below, I'm not going to be able to answer your question. But here's what I want to say is that this is what I typically give to my patients. And I actually think anybody over the age of 30 should be taking CoQ10. I know that sounds really young, but because it starts to decrease, now they don't have to take as much as somebody over 40 or somebody over 50, but maybe just like 50 milligrams to 100 milligrams. That could be a good rule of thumb. I really, for anybody, I like to start at a higher dose and then come down to a maintenance dose. And that means for 3 weeks, you're gonna have like a loading dose. That's gonna be the highest part of your range, a loading, or I guess you'd say a ramp up dose. And then after 40, I think your loading dose could be, 200 to 300 milligrams or 300 milligrams, and then you could come back to a maintenance dose of 200. But someone who has coronary artery disease or any of the diseases that I mentioned before should be at a higher dose. And if you're taking the ubiquinol formula, you could be at the lower end of your range. So that just depends on you and your healthcare practitioner, where you want to be on that. But remember that this is something that takes 6 months for it to really come into full effect when it comes to cardiovascular disease. If I was on a statin, I wouldn't be on one, but if I was on one, I would be taking at least 400 milligrams per day. So what is my favorite brand? And I chose this brand because of their reputation in the healthcare supplement industry. I use their omega-3 product extensively. Their Pro Omega 2000. Y'all have heard me talk about that. I think I talk about that on every video. But I love Nordic Naturals. Right now, it's Nordic Naturals because it's the COQ10 UBIQUINOL. And it also is in a base of olive oil that helps with the absorption, but there's vitamin E in there as well that also helps with absorption. And then it has some rosemary extract for a natural preservative, which I like as well. I looked on Amazon. That supplement is $51 for 60 caps. So what's so exciting is that I can offer my YouTube followers, as of last year, January of last year, I could offer my YouTube followers that supplement for 20% off through Wellevate. The link is below. It's very easy to set up an account, and after a certain amount, you get free shipping, and it really will save you some money because I understand that it is an expensive supplement, and you want to get the most bang for your buck. I do believe that ubiquinol form is the best. So thank you so much. I hope that was interesting. I hope that you understood more about CoQ10. The benefits of energy, especially for us over 40. Raise your hand if you're over 40. Especially for us older people is so significant, and the significance for heart disease patients is hands down, like Dr. Sinatra said, the most important nutrient that you could be taking. So it is worth every penny of using CoQ10, and I hope that you benefit from this video. Thank you so much. Please follow me on Facebook and Instagram and Twitter, Lindy Ford Nutrition and Wellness. And remember that every single person out there deserves to live their best life. Thank you.